Hello, welcome back. The beam now reached the detector. What will happen? How can happen? Previous lab exact anatomy directly. To understand detector, we must go back a little. Transmitted photon, we have scattered photon, and also at the same time, like dimension is also important. Absorbed photon do not reach the detector at all. Contribute only those to the patient. We will have our latent image form. That latent image will represent the potent, the transmitter potent, depending or based on the level of attenuation. Areas with the high attenuation, with the low attenuation, such as air in the lung, will have almost will allow 85% or more attenuation, or the object attenuation will give the construction of the image. Let's talk about the CR. So in the CR, mostly the PIM need to be read by a red laser so that we can have our main image. Then the trapped electron will get released in a blue violet photostimulable luminescence. Then the light. So in the end, reflection, which will lead to decrease spatial resolution, and some other artifacts such as ghost image and artifact, Murray at pattern, like wavy line across the image and the others. So these are the defects or of the indirect flat panel detector is as follows. So we have protective cover, we have scintillator or conversion X-ray. The X-ray heat scintillator, which will be convert that X-ray into charge directly without intervening light conversion. So the X-ray comes into the amorphous selenium. The amorphous selenium will form kind of TFT to read as a charge, and then to the conversion of the digital image. So because of the lack of light separate in the direct charge trapping effect, sometime lagging or gust possibility, high voltage bias, okay, sometimes detector saturation. Let's compare the direct to indirect conversion. So first, X-ray will convert light in the indirect, whereas in the iodide, the charge will be then converted by TFT to data and the image will be formed. So there are the differences between the direct and indirect DR conversion. Differences come with thallium, okay, it's just important to differentiate it from the, whereas the cesium iodide doped with thallium, we use it as a needle-like structure in the indirect direct conversion. Finally, digital imaging has wide dynamic range. This is powerful, but it can hide overexposure. The data be hide overexposure. So we have to use something. So we are using exposure index, give the quality image. So we cannot process anything to get the quality image post exposure. Let us recap. So remnant image reach detector, combining the signal and the image, then we have our detector type. So marks the end of this lecture, and the next one is going to be making the image of diagnostic.